right, we are back here on News Channel 5 Plus for an episode of Open Line where we are asking the expert, of course, the experts tonight, Foundations Recovery Network. And this is Siobhan Morse. Now, she is the Division Director of Clinical Services out there, and happy to take your calls this evening. I think you've done a great job answering the questions that you can. We were talking during the break a little bit about, of course, you know, if Foundations Recovery Network can't exactly help you with a particular issue, they will be more than happy to guide you in the right direction. Let's go ahead right now and pop up the information of Foundations Recovery Network. In case during tonight's show, if you don't want to call in right now, jot this number down, and afterwards feel free to give them a call during business hours. Are you all, do you have a 24-hour line? Yep. Wonderful. That's the number right there on your screen, 615-371-4091. And of course, you can always visit their website, frnhelp.com. Again, that's Foundations Recovery Network. Locations right here near Nashville, across Middle Tennessee, as well as throughout. Well, let's go ahead and talk about our next topic. Just overall, Siobhan, what is addiction? Describe it for us, symptoms, risk factors, everything.
So, the National Institute of Drug Abuse calls addiction a chronic relapsing brain disorder. So what's really interesting about that is, until about 4 years ago, if you Googled chronic relapsing brain disorder, what you got was multiple sclerosis. And so most people have really never made the connection that they're so very similar, right? And that relapse is not under my control in the same way. So at the end of the day, addiction is characterized by continuing to act out on behaviors, to have behaviors that one knows are harmful, but not being able to stop. That's one of the biggest symptoms. So,
what are some of the risk factors as well?
Genetics is a really strong risk factor. We mentioned that earlier. If addiction is in your family, you're predisposed. There are some life event risk factors. Trauma is very closely associated with addiction, and so that could be some form of abuse, neglect, childhood type of a trauma that happened. It can also be triggered in adulthood through trauma. And then there's a subtle type of trauma that people don't really think about that can also be associated with addiction, and that's that low-level, long-term chronic stress. And so that can actually cause a traumatic experience in the brain, and people who have trauma or a history of trauma are roughly 6 times more likely to suffer from a substance use disorder as well.
Overall, how common is addiction? I think you addressed this with a caller earlier tonight, but how common is it?
Again, you know, look at 4 houses on your street, and I promise that, you know, on that block, there is at least one person that is struggling with some level of this disorder.
Let's switch gears a little bit and talk about opioid use disorder. What are some of the symptoms? What are they? And of course, what exactly are they doing to the brain and the body?
Absolutely. So opioid use disorder has garnered a lot of attention in the past few years. Literally every 15 seconds, somebody is overdosing right now from opioid use disorder. Some of the symptoms, in any type of an addiction or substance use disorder, some of the symptoms that you're going to see are sudden changes in behavior. A whole new, you know, especially like in young adults, a whole new set of friends that somebody is hanging out with or talking to. More isolation, less available to be social, to be communicative. You know, there's simple, if it's out, you know, in some cases you might see things like slurred speech, changes in the pupils, you know, in the eyes and things like that. But really on a larger scale, you want to look for those types of behaviors. Just, they've become a different person and you're not sure why. You know, that would be probably the biggest thing that I would begin to look for. And if it's someone that you love, really, you know, stepping forward and having that loving, not accusatory conversation. Again, remember, brain disorder, right? So that conversation that just looks like, is something going on, and is there some way that I can help?
If folks were to call foundations, do you think you all could provide maybe just some guidance on how to have that conversation? I think that's a tough one to have with a loved one. Like you said, don't come across, you know, like you were accusing, but in a loving way. If people would call, would you be able to help them, maybe how to guide them on a talk like that?
I think our admissions counselors are super knowledgeable, and they work with family members day in and day out in those types of conversations. And, you know, at the and should there be, you know, a family member who really doesn't or has tried to approach it, has been unsuccessful, there's also the possibility of interventions.
Okay.
And we can connect you with an interventionist in your area and help you move into that conversation in the most loving and productive manner.
I think it's important to note that as you were talking, that question popped in my mind.
Yeah.
Another question tonight, we're going to turn it back over to the phones. This is, I believe, John. Hi, John. What's your question for us tonight?
Oh. I have a question. My question is, I have a tenant to live in one of my houses, and she's bipolar, and she's probably in her early 30s. And I found out that she's been doing drugs, so she had she had something. She got upset and she was tearing up the house and broke my window. And I hate to put her out because she's got a child and 2 grandkids. But I asked her about getting help, and she said she would. So I called the Buffalo Valley place over in Lebanon, but they said she had to call and do set up a profile. She had to call and do something. Is there anything that I can do as just a concerned person to get her help?
That's a great call. Thank you for that. We appreciate it, John.
Yeah, John, great job. Great job so far. Reaching out, putting her in touch with someone. At a certain point, though, she's going to have to take action, and that's just what it looks like. They can't admit or plan an admission without first knowing exactly what is going on for her and how to help her. I would reach out to the place that you spoke to already and continue that conversation, have them continue to help guide you. I think you've done a fabulous job. But John's call also highlights once again, right, the dual diagnosis, the co-occurring nature, how often mental health disorders and substance use disorders happen, you know, co-occur, and how important providing treatment for both disorders in an integrated fashion, you know, in a one-stop fits everybody, you know, one-stop addresses both, is in order to treat both diseases in the disease process.
You know, John's call perfectly brings me to the next question here, perfectly segues. When asking, you know, overall, just when you want to finally make that call, whether it's for yourself or a loved one, how do you go about that? And what can people maybe expect when they do reach out to you all?
So what they can expect is there's going to be someone who answers the phone who has walked hundreds of people through the process of getting a loved one or getting themselves into treatment. You know, there's confidential assessment. They're going to have to ask some questions that are fairly personal in nature just to get an understanding of where you are, you know, or your loved one is in the disease process, some of the consequences, some of the issues that they're facing. They'll collect other information about your family and the person you're seeking help for. They'll help run a financial analysis to see if we're a good fit for you in terms of all of those different parameters, both personal, financial, psychological, if we can meet your needs, and if we can walk you forward into that process and help you get there. And if we're not a good fit, we're going to help you find some place that is.
Wonderful. Okay, so let's say that you are ready to make that step, or your loved one is, but they are concerned about, and this is I mean, obviously this makes a lot of sense, if they can't leave their job or their personal life, how can people still get help if that's the situation they're in?
So that's where outpatient comes in, outpatient treatment. That's the beauty of outpatient treatment. And so there's different levels of outpatient. There's intensive outpatient, and there's just a sort of regular outpatient. Depending on the severity and the acuity of what's going on for the individual right now, a lot of times outpatient is a great option. You can continue to work. You can very confidentially receive both individual and group treatments, see a medical provider, and get the care that you need while you still can, you know, stay inside of your life.
So, Siobhan, what are some of the most common reasons that folks are still just afraid to make that call and pick up the phone?
Shame. You know what? Shame is probably one of the biggest reasons. So characteristic of addiction is this idea that it'll be better tomorrow, right? I'll fix myself tomorrow, and that's not. Very rarely is that possible, and so shame has this really bad habit of the more that we feel ashamed, the more we continue the behavior we're ashamed of. It sort of drives us to that. And hope diminishes as shame increases. So the truth is that if you were having a mild heart attack, you wouldn't say, you know what, I'll be better tomorrow. I'll just calm down. I can breathe through this, right?
That's a great point.
You know, you would reach out for medical help. And that's probably one of the big shifts that we were talking about opiate use disorder that's happened, is that really through moms, right, grassroots moms around the country who were just tired of seeing their sons and daughters get caught up in something and get sick, and were tired of being ashamed and afraid to say, my child has a problem. Right? They began to really break that stigma, and they've been moving this into moving the idea of being addicted or of substance use disorder into a true, this is a disorder. This is not like your fault. You know. So if you're listening, if you're scared to call, it's not your fault. There is hope. We do recover.
It is sad that there is a stigma surrounding this, and I hope we can progress as a society to have these types of conversations and these types of, just providing hope. Of course, we are so happy to take calls tonight. Like I said, that number, we'll give it to you a little bit later in the show if you want to reach out to Foundation's Recovery Network, maybe later tonight or sometime tomorrow. But Siobhan, you've given us such great information tonight. We have much more coming up after another quick break. Just keep it right here.